Hey, future medics, Tina here, your medic mentor. And today we're going over one of the most important medications you're going to give, and that is aspirin. Don't let this tiny little chewable tablet fool you. It is one of the simplest and oldest medications that you know, but don't underestimate what it can do during a cardiac emergency. So let's get into it. Aspirin is the trade name and the generic name, making it easier for you. And sometimes you'll see it abbreviated as ASA. That's a common abbreviation for aspirin, just so you'll know it when you see it. Now, aspirin's classification is an antiplatelet aggregate. That means it doesn't allow the platelets to form together to make a clot. And that's important because if you already have a clot causing chest pain, now it can't get any bigger because nothing can stick together. In EMS, indications for aspirin are patients presenting with chest pain that we think is from a cardiac event. So, acute coronary syndrome or STEMI. And the goal here isn't to reverse a heart attack because we can't do that in the field. It's to make sure that it doesn't get worse and that we can hopefully eliminate or decrease the amount of muscle that is affected by the loss of blood flow. By not allowing that clot to get any bigger, less muscle gets damaged along the way. The dose is 324 milligrams. That's four of the tiny chewable, don't swallow them, chew them, four of the chewable baby aspirins, which are 81 milligrams each. 81 times 4, 324. Now, there are also some of the big tablets out there, and in one big tablet, it's 325. So if you get to your patient's house and they say they took one aspirin, make sure you figure out if they took one big one or if they took one tiny little small one. Because if it's one tiny little small one, you need to give a few more. Now, because this medication doesn't allow clots to build up and form, it's going to be contraindicated in anyone who has an active bleed. So think people with active GI bleeds, and I mean active, not they have had a history of ulcer in the past. Like right now, they definitely have an active GI bleed. Okay. So also it's going to be contraindicated for anyone who's had trauma because again, this medication is not going to allow clots to form to stop the bleeding. Also important to know that aspirin can make asthma worse. It's not a contraindication, it's just a precaution, something for you to know. Side effects for this one are rare. You might see nausea or GI upset, but with the small dose that we give, it's not that common. Something to know though. And that's it. That's another one done. You're doing so great. The takeaway on this one is that aspirin does not fix a heart attack. We cannot do that in the field, but it does prevent it from getting worse and hopefully buys us some time to get them to definitive care to get that taken care of. I'll see you for the next one.